Hello, my name is Dr. Bryan and I'm here to give you some healthy hints for harmony. Today we're going to talk about the treatment of upper cross syndrome. Now, in order to treat upper cross syndrome, you need to address the soft tissues and the muscles that are associated with it. Some of the muscles are tight and some of the muscles are weak. So what you need to do is have some myofascial release or myofascial work on some of them and some of those muscles, and one of the things that we use is Graston technique in order to help to release some of those tightness and those myofascial adhesions that are associated with that. We also do exercises as well in order to strengthen the weakened muscles and stretch out the ones that are a little bit tight. One of the exercises that we use in order to treat upper cross syndrome is Brugger's exercise. And Brugger's has a couple different components to it, but what it is basically the reverse of the posture that someone has in upper cross syndrome. So again, the posture is someone that has a rolled forward shoulders and their head is being forward. So as opposed to being up here like this in a better posture, you're down and you're forward like this and everything is rolled. That might be exaggerated a little bit for some people, but that's a general thing that you find in a lot of people overall. So the idea is that you want to reverse that. So the first step is to take your shoulders and bring your shoulders back as far as you can and then push them down. So it's not just going back, it's also going down like that. And you can see that from the side here. When I have my shoulders forward, you want to pull them back and then you want to pull them down. Okay? After you do that, the second part is pretend like you're holding two bowls of soup in your hand. So while your shoulders are back and down, you're holding on to the soup, and then the idea is that you're going to open yourself out like this to the side, and then pretend like you're pouring out the soup behind you like that. Okay? So it's that motion where you're rotating back like this when it comes to the hand, when you do at the end. And then the last step that you do is you take your chin and you tuck your chin back. So it's like you're doing one of these, and you're tucking your chin straight back. You're not taking your head up and you're not taking your head down. It's a straight back. And when you do it, and you do it right, you actually notice that you'll give yourself a little bit of a double chin, and that means that you are doing it right. So basically what happens is that you put all of those together, where you take your shoulders back and down, you take your arms and open them out to the side like that, and then you take your chin and you tuck your chin back like that. It makes it a little hard to talk. But you hold that posture in the morning and you do that for about 60 seconds total. You can break it up and you can do 30 seconds 2 times, or you can do 20 seconds 3 times, something along those lines. But you do it in the morning for a total of 60 seconds, and then you do it at night for about 60 seconds. And then overall throughout the day, you can use that to take breaks during the day. Like if you're working at a desk or a computer and you go to get up or do something, just go and do that stretch while you're sitting if you want to, sitting on the edge of the chair. You can go and do that stretch and basically hold that for maybe 10-15 seconds and then get up and do what you're doing. And that basically is going to help to correct the posture from here back to here over time. Thanks a lot for watching.